Um, how many people here have a connection to the Dalhousie School of Public Health? Raise your hand. And how many from family medicine? We have one of those partnerships. We are partners in health. And that was a lovely tribute that Catherine Rouleau gave, which is that part of our mission is to integrate and be Canadian and be partners in this journey. I sometimes describe myself as a recovering American because I did move here in 2012, still learning how to be a Canadian. But in fact, I did have the pleasure of teaching in a classroom with Paul some 20 years ago. And this was a class that several of us started very excitedly after we got back from the 1992 Rio Conference on Environment and Development, and realized at this gigantic world conference that there's this huge conversation going on about the destruction of the world's forests and the loss of biodiversity and the pollution happening worldwide. But in fact, no one was talking about health. So we ran out and wrote a book and started a class on the global environment and human health, and Paul was there talking about the conditions in Haiti, and we're trying to tie all these things together, and we ran out and got foundation funding to bring in not only our local superstars like Paul, even back then he was a superstar. We brought in some folks who were leading the climate change debates and what was happening with the fluorocarbons around the world and UV light. And that course ran for 10 years. It brought students all over the university, from the law school, the business school, the medical school, the public health school. And then the course died. You know what happens. You know, foundations get tired of funding the same thing. And the department chairs and the deans said, well, you know, you're not really bringing in research funding, and, you know, our donors, they're not really interested in this. And the course went away. You might remember that, Paul. But, you know, 20 years later, shoes on the other foot. Now the hippies have grown up. Now we run the schools, we run the departments, right, Paul? And we can say we're going to bring it back. So I'm very delighted to share with you, in fact, that we are recreating this very same course. It's being led by one of our global health stars, Abdullah Dar. It will be launched in January 2015. The target audience is undergraduates, because it's not just those of us in healthcare, in public health, who need to know about these issues. It's the people who will eventually go into law and business, starting up the industries, who need to know something about these connections, about the globalization of health, how, as Margaret Chan put it, health is no longer a luxury to be afforded with development. It is a precursor for development around the world. That's our ambition. It's an ambition shared by our colleagues in Boston and everywhere else. One of the other themes that I wanted to pick up on related to Paul as a person is that what you hear is the passion, the impact, what Partners in Health has done, but in fact, Paul's source of the power and the persuasion is from the fact that he's a professor. There is no disconnect between those who want to change the world and who have passion in the world and sitting in the ivory white tower, the way that the public sees sometimes us in places that are remote, that are generating knowledge that may trickle down. Because in fact, there is the ability to generate the evidence that will tell us where the levers are, what will actually create economic impact in the way the policymakers understand it, and save lives in a profound way that you saw in these slides by using the power of knowledge. when Paul and I met, I had the privilege also of working for Physicians for Human Rights. And when I was doing this work, I was a fellow and working on my epi thesis and doing some other work. And Paul may remember that we had a chief of cardiology then, Eugene Braunwald, who was particularly my boss. He was the chairman of medicine, and he wrote all the big cardiology textbooks, and his nickname was Jaws. Yes, that's right. And at one point, he heard about, you know, this Howard Hu guy sort of traveling to Iraq and Turkey and Guatemala and everything, and he was raising questions with my immediate boss, Frank Spicer, who was one of the directors of the Channing Lab back then. And Frank ran interference for me, you know, saying, oh, no, well, don't worry, he's still working his thesis, and these are very small sort of things. I was spending months, you know, sort of out in the field and working on this stuff. And Frank told me, you know, this is great. I really love the passion you bring to this, and I know you'll finish your epi thesis, right? But let me just give you a word of advice. You know, when you do this sort of stuff for Physicians for Human Rights, try to publish it, you know, because then you'll get a couple more chits out of it, and I can keep Eugene Braunwald off your back. And we did that. We did that in a way that allowed us to, for the first time, bring epidemiology to human rights fact-finding. This is some of the stuff that we did. And we did that to look at violations of medical neutrality as a population-based science. And some of these tools are tools all of us can use because that's what we train to do. And you can marry these skills that you have and bring evidence to the things that you're really, really passionate about. And that's part of what you heard today, because Paul has been giving you statistics, but what he hasn't told you is the dozens of publications PIH and his partners have been putting out that give us new ways of implementing therapies in tuberculosis and looking at how rights actually make a difference in the field and how politics may interfere with the way we look at the distribution of resources. And some of these same tools can even be brought to other endeavors. Paul and colleagues recently published work looking at the new chronic disease epidemics that we're beginning to grapple with, another chronic disease dimension to the global health challenge, particularly as it relates to cancer and cardiovascular disease, et cetera, et cetera. We can do that together as a partnership. Well, you know, when Eugene Braunwald retired, I remembered the one encounter I ever had with Eugene Braunwald, which is, you know, he never met me personally, but one day when I came out of Grand Rounds, he stopped me and he said, Doctor, that's not appropriate footwear. I was wearing sandals. And 15 years later, he retired, and I sent my sandals to him in a box. And I said, you might, yes, you might find these useful in retirement. Anyway, these are, you know, funny things that happen to us when we grow up, but eventually you will get the skills, and it's incredible that this room is filled with young people who hear these stories and really are the ones who will carry the torch in the very near future. You can have make a difference that even now you wouldn't even be able to dream of, but because of the knowledge and the skills you bring out to the field, and the collaborations we'll build together, you will be able to make those differences. Now, just a word about the Dahlana School of Public Health. We are privileged to be working on global health in a new way here in Toronto. We have incredible strengths of global health throughout the university, but in fact, we are still punching under our weight. We have an opportunity here to knit together a lot of these strengths around themes for which Toronto in particular can lead. That relates to our particular geopolitical status in the world, the investments that have been made in primary care and public health in a single payer system. Nah, you don't have that yet, really, in the United States. and some of the connections that have already been made all over the world, in which our scholars, your scholars, have ongoing in Addis Ababa, in Rio de Janeiro, in Shanghai, in Beijing, and all over the world. We do have a new Institute for Global Health Equity and Innovation. Many of you are working this. Equity and innovation are words that are used a lot, but in this case, we have such abilities to bring this discourse to the next level in this university. A lot of this will be seen and heard in our Global Health Summit that we're organizing here in Toronto. That will take place November 3 through 5. If you haven't heard about it, you'll be getting the announcement soon. It's all about creating a pandemic of health. It's turning some of the concepts that we hear about on its head to create a different vision of how we conceptualize health around the world. Some of the co-organizers are sitting right here in the second row. Alex Haddad, raise your hand. Ronnie Kotha, raise your hand. They'll be communicating, and I've already met many of the people in this room. Maybe we'll be able to entice some of our best scholars to come back. We'll be talking with Paul Scheduler about this, and he's enjoying Toronto on his visit. And PIH will be a partner for us in many ways, academically and in a vision that relates to some of our ventures together around the world. So thank you very much, and welcome, Paul. You better come back soon.